Evening, everyone. Today I'm going to be talking and discussing the Ferguson reflex and the role it's going to play in canine parturition. All right, so most of us already understand some general hormonal changes around labor, but this reflex is the specific mechanism that's going to connect the physical stretching of the cervix to the uterine contractions we expect to see during whelping or birth. The process is going to start when the cervix and cranial vagina stretch as that fetus begins to move downward, and that stretch is going to activate sensory pathways that signal the hypothalamus and trigger the release of oxytocin from the posterior pituitary. And once that oxytocin is released, it's going to strengthen the uterine contractions, and this is going to create that positive feedback loop that we think of when we think of labor. This mechanism is going to matter clinically because if any part of it fails, the neural signal, the hormonal release, the receptor response, or the myometrial strength, the dog may develop uterine inertia or dystocia, both of which are going to quickly become emergencies. So today I'm going to try and walk through this reflex and how it works, what influences it, and how problems with the reflex show up clinically. All right, so the Ferguson reflex is going to begin with that mechanical stretch. As a fetus enters the birth canal and starts putting pressure on the cervix and cranial vagina, stretch receptors in those tissues are going to fire. And that firing is going to produce an afferent signal that travels to the hypothalamus, which is going to stimulate the posterior pituitary to release oxytocin into the bloodstream. Oxytocin is then going to act on the uterus to increase contraction strength and coordination. And what's important for us to remember here is this positive feedback loop. As the contractions are going to generate more fetal pressure, that's going to increase the cervical stretch, and that's going to trigger more oxytocin release. And this is going to continue until active labor is over and the fetuses are expelled. That's what we would expect in a normal, healthy, progressive delivery in a patient. That's what we would hope for. Now, without this neural hormonal loop, labor is not going to intensify the way it should, and the uterus may not generate enough force to expel those fetuses or fetus. Oxytocin is going to be at the center of this reflex. It binds to receptors on the uterine's smooth muscle, causing those rhythmic coordinated contractions. And these contractions are going to be what propels each fetus through the birth canal. Now, from a clinical standpoint, oxytocin is something that we think about in dystocia cases. It's important to understand that oxytocin is only effective when its receptors are present and responsive, because if the uterus has been contracting for a long time, those receptors are going to start to become desensitized. And this is why giving repeated doses of oxytocin during a prolonged dystocia sometimes isn't going to help. It doesn't mean that there's no oxytocin present. It means the uterus can't respond to it the way it normally would. So far, we've talked about the hormonal signaling, but the reflex also depends on the physical ability of the uterus to contract. For contractions to be strong enough, the myometrium needs healthy levels of protein, such as actin and myosin, which we've discussed during class. A study by Egloff et al. In 2020 showed that dogs with uterine inertia often have altered expression of these contractile proteins. And that means that even if oxytocin levels are appropriate, the uterus might not be able to generate the force needed for delivery. And this is a good reminder that the Ferguson reflex isn't just about hormones. It's going to also require both the chemical signaling and the muscular machinery to be functioning together. So when the Ferguson reflex isn't working properly, one of the major outcomes we're going to see is uterine inertia. And there's two types. Primary inertia is where the uterus never establishes effective contractions. Secondary inertia is where the uterus initially contracts but then becomes exhausted after prolonged labor. Both forms are going to lead to dystocia, fetal distress, or even stillbirth if not managed appropriately, as well as possible death of the mother. And these cases are going to be emergencies, and understanding where the reflex went wrong is going to help guide our treatment. Recognizing these signs early is going to be one of the most important skills in managing canine parturition. Now, there are a few patient-specific factors that influence how well the reflex is going to function, and one of the major ones is breed. Brachycephalic breeds, your bulldogs, your pugs, your Frenchies, all the flat faces, are known for their high rates of dystocia. Gendron et al. In 2020 found significantly higher C-section rates in these breeds due to their anatomical and physiological factors. Another factor is parity. Lizama Garcia and colleagues in 2023 found differences between primiparous and multiparous dogs in uterine dynamics and fetal monitoring patterns. First time mothers may not have the same contrail strength or responsiveness as dogs who have delivered before. So, breed, body size, and reproductive history all affect how efficiently this reflex works. Now, even though oxytocin is the star of the reflex, it's not going to be acting alone. Labor relies on a whole hormonal environment to function properly. And one of those is progesterone, which has to fall for labor to even begin. As long as progesterone stays high, the uterus is going to stay quiet. Prostaglandin E2 is also going to play a role in strengthening these contractions. Rimpel et al. In 2021 showed it may influence contractility in dogs with uterine inertia. And then there's calcium, which is essential for muscle contraction, as we've learned. Tamanin et al. In 2019 found that dystocic dogs often have altered ionized calcium levels, which may weaken contractions. So the reflex depends not only on oxytocin, but all of these supportive hormonal and electrolyte conditions. Now, one key factor that influences labor progression is the oxytocin receptor sensitivity, which I would like to focus on. Smith et al. In 2021 found that during prolonged labor, these receptors become desensitized, and when that happens, even normal or elevated oxytocin levels aren't going to generate strong contractions, and that's where we really run into problems. And this explains why giving multiple doses of oxytocin isn't effective, as we've stated. The problem isn't going to be the hormone, it's the receptors, and there's not a quick way to fix that. Timing is going to become really important here because the longer labor drags on, the less responsive that uterus is going to become to oxytocin. When the Ferguson reflex isn't enough to support normal labor, we veterinarians are going to have several tools. Oxytocin administration is one option, as we've mentioned, but it must be used carefully to avoid overstimulating the uterus. We do not want to overstimulate the uterus and cause too many contractions or desensitize those receptors, as we said. If hypocalcemia is contributing to weak contractions, calcium supplementation is an option, and prostaglandins may also be used to enhance uterine activity when appropriate. Throughout all of this, monitoring is essential of both the mother and the fetuses. Rasquin and Sones in 2024 emphasized the importance of fetal heart rate monitoring and tracking contraction patterns to make sure that both the dam and the puppies remain stable. Ultimately, the goal is to support the reflex, identify when it's failing, and intervene in a way that keeps the whelping process as safe as possible. Here we have an example of a sheet of a recording of the fetal heart rate and the uterine contractions of the mother's uterus. So, to wrap these things up, the Ferguson reflex is a crucial neuroendocrine mechanism in canine parturition. It's driven by that cervical and vaginal stretch, neural signaling to the hypothalamus, and oxytocin release from the posterior pituitary. The reflex strengthens and coordinates uterine contractions through a positive feedback loop. Its effectiveness does depend on oxytocin levels, receptor sensitivity, the structural integrity of the myometrium, and the broader hormonal environment. Breed differences, maternal body condition, and parity can all influence how well the reflex functions. Clinically, understanding this reflex helps us identify uterine inertia, make informed decisions about medical management, and anticipate complications during labor. Thank you for listening. I hope this helped clarify how the Ferguson reflex fits into the bigger picture of canine reproduction and why it's such a central mechanism in normal labor. And I would like everyone to remember that the Ferguson reflex isn't only present in dogs. We humans go through it, cows go through it, most mammals, when they give birth, go through the Ferguson reflex. So it's really an expansive piece of knowledge to have. Thank you so much.